From anatomy to anesthesiology, from pathology to pharmacology, from microbiology to medicine, a one-man resource to the world of health sciences. Welcome to Dr. Paul's Medical Lectures. A practicing physician, Dr. Paul offers you essential insights on diseases afflicting millions of people around the world. For today's lecture, here is Dr. Paul.
This is Dr. Paul. Thank you very much for tuning to our channel this evening. Today I want to talk a few minutes about antidepressant-associated or antidepressant-induced sexual dysfunction. You see, SSRIs are the most commonly used antidepressants in clinical practice today. So they are the main cause for antidepressant-induced sexual dysfunction. So now sexual dysfunction, and it happens in many forms. We see commonly in men and women, and the tragedy is many times we don't even talk about it. And SSRIs, they impact almost every cycle of sexual function. It can decrease the sexual desires and can cause erectile dysfunction. It can cause absent or delayed orgasm, and it can cause delayed ejaculation. So it can impact all phases of sexual cycle and can cause distress to the patient. You see, SSRIs are basically serotonin reuptake inhibitors. So they are increasing the concentration of serotonin in that neuronal gaps. All right. So how can we treat this? We can give medications that can actually block serotonin. And the same thing with the dopamine. Most of the psychiatric medications, they block dopamine. So we give dopamine when we want to treat these patients. So that is the mechanism. Now let us see some of these medications. Cyproheptadine. It has anti-serotonergic properties. That's why cyproheptadine, it has been shown to be effective to treat antidepressant-induced sexual dysfunction. Okay, that's the number one. Cyproheptadine. Think of that. And the other times you can also try drug holiday. That means just decrease the dose of the SSRI and keep the patient like that, and then restart it. The other medication is bupropion, that is Wellbutrin. Wellbutrin, we use it for persistent anxiety, but Wellbutrin, that is buspirone, it can decrease these problems caused by sexual dysfunctions caused by SSRIs. The other medication is nefazodone and Amantadine. These two drugs, they have these serotonergic properties, serotonergic blocking properties. So nefazodone, it can reverse the sertraline-induced anorgasmia. The same thing with Amantadine. It has these 5-HT adrenergic antagonistic properties. The other medication is Amantadine. It's a dopamine agonist. You see, Amantadine is an antiviral medication. We can also use it in Parkinson's disease. Remember, Parkinson's disease is due to the deficiency of dopamine. So we give Amantadine even to treat sexual dysfunction caused by SSRIs. So bupropion, that is Wellbutrin, and Amantadine, these medications, they have shown to reverse sexual side effects caused by SSRIs. And they have this dopamine agonism, and some of these medications like pamolin, diamphetamine, you can also use those medications because they have shown to improve the problems. The other medication is yohimbine. Yohimbine, people use it in the past days for sexual potency. It's an alkaloid that's now come from the bark of Coryanthe yohimbi, a plant. So people used it for sexual pretense. That was the ancient Viagra. So yohimbine, you can use yohimbine to treat these patients. And the other medication is bethanacol. Bethanacol is cholinergic agonist, and it has been useful in reversing sexual dysfunction associated with TCAs and MAO inhibitors. And ginkgo biloba, it is also shown to be useful in some patients. So those are the medications. Remember what exactly SSRIs do. They are serotonin reuptake inhibitors. They are increasing the concentration of serotonin. And the other medications are blocking the impact of dopamine. So you can either use serotonin blockers or dopamine agonists to treat these sexual dysfunction induced by antidepressants or SSRIs. And those are the main medications. And what I do, I have patients with SSRI-induced sexual dysfunction. You see, many patients, they feel shy. And many men feel shy. And many women feel shy to discuss that sexual dysfunction. So you should always ask the patient, how you are doing? How is your sexual function? You start a patient on Zoloft or Paxil or anything, any SSRI. And you need to follow them like 1 or 2 months down the road. You should follow up with these patients. And you should ask the patients, how is your sexual function? And when the patient says it's not going well, and that means they are developing the SSRI-induced sexual dysfunction, and you should do something about it. You should not ignore it. You see, they are walking a thin line. They have to balance between treating the depression on one hand and to live with this distress caused by the sexual dysfunction caused by these medications. So that's a thin line. And in that situation, you need to think about strategies to deal with it. You can give drug holiday. Drug holiday is decrease the medication and see how it helps. And stop it completely and see how it helps. And start it again. You can also start a new SSRI because patient doesn't have to have the same side effects to a different SSRIs, even though one SSRI side effects are also common with another SSRIs. Patient may not have the exactly same side effects to every SSRI. So you can start a new one, or you can just deal with these problems with the medications I have just discussed in today's topic. So SSRI-induced sexual dysfunction is very common. Please remember that when you give these medications.
Thanks for listening. For more medical videos, please visit us at www.drpaul.org and take time to browse through hundreds of health videos we regularly post on our site. If you are preparing for USMLE, PLAB, and other medical exams, make sure you visit our website to browse through our videos explaining the essential points you need to know before taking these examinations. For more information, visit us at www.drpaul.org. Thank you, and may God richly bless you. Are you preparing for USMLE? Please do not waste thousands of dollars on training courses. Get the books written by Dr. Paul with the student-to-student tips and memory aids. The success will be yours, and you will soon realize your dream of becoming a physician in the United States. If you are preparing for Step 2 clinical skills, study USMLE Smasher, a guide helping thousands of medical students to pass this examination. For more information, visit us at www.drpaul.org.